Why can't I focus? Hello, everyone. Welcome to today's episode of The Mix with Nene. In this episode, we are focusing on mental health, a topic that affects us all in different ways. Joining me today is Gondwani Chira, a mental health expert. We will be talking about the importance of mental health, ways to manage it, and how we can all do a better job of supporting ourselves and others. So stay tuned as we dive into this crucial conversation. How do you define mental health and wellness?
Thank you. So mental health and wellness is not what we think as an absence of mental disorder, but it has something to do with somebody's ability um, to handle life stresses. They should be able to contribute to their community. They're able to learn. They're able to balance their emotions. So that's what constitutes mental health and wellness according to the um, WHO definition. I'm just uh, paraphrasing. So someone has to be able to relate to his community. They should be able to contribute to the community. They should be able to learn. They should be able to handle day-to-day life stresses. That's what constitutes mental health.
So, what are some of the classifications of mental illnesses?
Um, Hard to classify, but I think we can group them into mainly two categories. We have what we call non-affective and affective mental disorders. So in affective, um, in simple terms, these are something that would manifest themselves with changes in somebody's mood. For example, anxiety, um, depression, bipolar, maybe PTSD as well. In an affective, you do not have really manifestation of mood changes in conditions like schizophrenia, where schizophrenia is simply, those people you see on the road with disorganized behavior. They're just moving around, picking things from trash. It's not really related to mood changes. So that's how maybe we can classify them. Some also say primary and secondary. Primary would be something just happening without really a cause that you could explain. Okay, but then secondary would be it's happening because of something, maybe of a sickness, or maybe alcohol abuse, or maybe smoking. So those are secondary mental illnesses. And most of the affective disorders are secondary. For example, depression would be secondary to something, maybe a sickness or some traumatic experience that someone has had. Yeah.
Okay, so you talked about those people who just run around in the roads. Does it have a specific name for it, or they're just called mad people, just like we call them?
We normally say they have schizophrenia. Others would have mania. Mania, where someone is just, excited, they're doing things. Yeah, so those people, it's mostly schizophrenia, which is characterized by disorganized behavior and some other things like delusions and hallucinations.
Do you think those things are related to spiritual life?
Depends, because when one has schizophrenia, they may have what we call delusions of religion, where they feel like they have some religious powers. Some people would become more religious during that time from nowhere. The only difference is that it would be a strange behavior, something that they weren't portraying before. They will start showing it now. So in delusion, one will have a belief which is contrary to the society culture, and it doesn't get shaken even if you present to them with evidence. Some people who have like grandiose belief, they will believe like they have some sort of power. They'll say, I'm able to talk to God, I'm able to talk to angels, I'm able to do, some power to heal all these people. They would go maybe in a hospital and then claim that they can heal everyone in the hospital. Something which, if the society doesn't agree with it, we'll call it abnormal. And that's a delusion, and that's a sign of schizophrenia.
Madness.
Madness, maybe in layman's term, but we try to respect them.
You have talked about these classifications of mental illnesses, right? Mental illnesses, right? So,
Yes.
how do you diagnose these mental illnesses?
So mostly it's clinical evaluation where you're looking at the history, what has been happening to these people, their signs and symptoms. There's something that we call phenomenology, where you're looking at manifestation of somebody's mind through whatever they are portraying outside, like the behavior, whatever they are feeling, their mood. So we look at those things, and then not everything which is abnormal is a mental illness. So we have a guideline which we call DCM. So now we are using DCM-5. This stands for Diagnostic Statistical Manual. So we have DCM-5, a revised edition now, which we use the guidelines which are given there to make a diagnosis of a condition. For example, if someone has depression, we say should have the major symptoms and signs, which is maybe mood, low mood, persistent low mood, that is, ahedonia, where they're losing pleasure in whatever they used to like before. They should have those for a period of at least 2 weeks. So if you have had those things for at least 2 weeks, that's when you can say they have depression. So we have that guideline which helps us to make the diagnosis. Unlike in other medical conditions, it's very hard for us to do what other people may do, like doing lab tests and everything. The lab test may come in handy just to establish maybe what is a comorbidity in those people, or what else they are suffering from, or what might have caused that suffering. But otherwise, we mostly use clinical evaluation and the DCM-5 to make a diagnosis of these conditions.
You talked about lab things. Can you repeat what you said about lab?
So the laboratory tests don't really help us to make diagnosis per se. They may just help us to, one, maybe we are monitoring the condition of the patient. Two, maybe they have other diseases that they're suffering from. Three, maybe that disease we are looking for is what caused the mental illness. For example, if someone came in with issues of alcohol, would like to do some tests to establish the claim that we are saying it's alcohol. Or maybe we are trying to monitor any damage that the alcohol might have caused, like the liver. So we may do liver function tests to rule out other damages that the alcohol might have caused.
Does Malawi have these kind of laboratory tests for mental illnesses?
No, we do not have laboratory tests for mental illness, as I have said. The laboratory tests are not done for the mental illness. They are done in case the patient has other issues, or we think other medical conditions are causing the mental illnesses.
What are the differences between various mental health conditions?
Okay, I don't know what the question is looking for, but I perceive some of them, as I explained earlier when we were classifying them, will show you mood changes. Some of them will give you not mood changes per se, but some disorganized behavior. Um, and some of them may be secondary to some behaviors like smoking and drinking. And some of them are related maybe to events like losses, let's say when talk of PTSD, post-traumatic stress disorder. So maybe someone experienced a loss or a traumatic event in their life, and then this may come later and affect them. And some of them are commonly associated with the issue of suicide. For example, the PTSD, the depression, mostly the mental, not mental disorder, but then these ones which are affective, they're mostly associated with mental disorders. And some of them may not need medication per se as the first line of treatment. You may need to counsel the patient, do what we call cognitive behavior therapy. So, depending on what type of mental illness you're dealing with, you also consider what type of treatment to give.
What therapies or interventions have proven most effective for mental health?
So, depends on what disease you're treating. Um, for example, when it comes to depression, the PTSDs, the eating disorders, these ones mostly it's cognitive behavior therapy. Uh, Maybe dialectical behavior therapy, counseling, okay, family counseling. These ones have proven to be really good and better. We also have the pharmacological approach where we um, give them medication, maybe mood stabilizer, so that maybe their mood can stabilize a little bit. For the diseases like schizophrenia, we have Zomba Mental Hospital, that side where we admit these patients and they are given drugs which make them better. So I can't really say which one is better because it depends from disease to disease. For schizophrenia, really, they have to get involved. Mostly we engage the pharmacological treatment modality. Unlike in the maybe depression, PTSD, medication may not be your first option. You may consider the counseling, then the pharmacological one, where you're just psychologically treating them.
How do you incorporate mindfulness or self care into treatment plans?
Do you know what mindfulness is?
No.
Okay, so mindfulness and self-care, these are very important skills for everyone to acquire. The simplest example that I can give you about mindfulness, you've seen those people who believe in Buddhism. They have a certain time where they meditate. They're just there meditating.
Yeah.
That's mindfulness. It's like you're trying to live in the moment. Like you're trying to appreciate each and every moment that you're living. So you stay quiet, you think about it. For example, you're eating, then you have to focus on that one thing. So you can control your mind to think whatever you want it to think at that particular moment. So it comes in hand with the issues like maybe the stress disorders, the anxiety disorders, where you'd shift your mind from one thing to one particular moment, which is very good and positive, so that you feel better and you live in that moment. So self care is where you know, okay, at this particular moment, this is how I'm feeling. So what should I do about it? Okay, let me listen to music. Let me take a walk. Let me go for some sports or something else that would help you that particular moment. So that's self care. So these are very important because they determine how worse a disease can get. If someone doesn't know how to handle a particular situation, you know, if they'll face any stress in life, these people are the ones who will go on the edge, and you hear maybe they are attempting suicide, they're in depression and everything. And it also comes in helpful when the neighbors or someone who is around them, you know how to handle such kind of people so that they don't get to those particular extremes. So these are very important to be taught, really, in as far as mental health is concerned.
How does social media impact mental health?
Social media. Will answer this one by giving examples as well. One, it's a good platform where almost each and everyone is these days, where people can get information. So if we rightly used, we can use it to educate people about mental health. Social media, if abused as well, can also result in catastrophic results. We have heard of cyberbullying, misinformation, and maybe wrong way of delivering information. It can also trigger other people. For example, suicide. The way other cases of suicide are reported, with so much details that someone else who's in similar situation can think of committing suicide as well. So the way suicide information is given on the media is another issue that has to be discussed as well, because it can trigger other people to commit suicide. As I've said, it has a positive side where we can give people information about mental health. So if I think we can use social media in that way, it can become helpful in helping spread the information of mental health.
Yeah, what role does stigma play in mental health, and how can you reduce it?
So stigma is one of the things that we really have to deal with. Um, it has costed us a lot of lives because okay, imagine someone who was working has a status in the community and then they develop maybe schizophrenia. It means they may lose their job. They may no longer be respected as they used to be. So these people are the ones who are sidelined in the community. They cannot be given any chances or the love that they deserve. So in most cases, stigma tends to worsen the situation because the time these people have mental illnesses is the best time for them to get the best from the people around them. But unfortunately, that doesn't happen. So I think mostly it's the education that people need so that we deal with stigma. We need to educate people that that's the time that these people need the most of our love, support, and availability. And we need to accommodate them as human beings because people tend to think maybe they are beasts or something else. For example, the people who are just maybe in the road picking things with disorganized behavior. They are as human as we are. So if we are to educate people in that way, they would change their mindset and then would come back to accommodate all these people. And that would also help with their recovery as well.
Okay, those people who run in the roads picking you, like you have said, organized behavior, right? There are sometimes pretty dangerous. You know that, right?
Yes, sometimes they are.
So how can people show them? How am I supposed to say this? How can they be friendly to them when they are always aggressive?
Yeah, aggression, but then uh, we can teach people how to de-escalate the aggression which is in the patients. Maybe hold them, give them medication timely, and that can help to lower their aggression and then be as normal as they're supposed to be. It's a matter of incorporating all those treatment modalities, the psychological, then the pharmacological. These people can always be calm. And you see them in the hospitals when you go to mentor, you see them there somewhere else. You can actually talk to them once they are stable. They're just good people.
Okay, so how can we promote mental health awareness and education?
Yeah. I think that's an important element. So one of the ways would be incorporating it in our curriculum, school curriculum, so that people at some point get educated, whether it's to they're in schools, maybe in secondary school or in tertiary school, should not be only left for the mental, I mean, the healthy professionals, but everyone else should learn about it. Another way, as we talked about, the social media, um, make sure that we have good platforms where people can get information. Another way would also be launching campaigns where you would go maybe in a community as an outreach, where you would sensitize people on how they can deal with the mental health illnesses, how they can take care of the people with the mental health illnesses, so that each and every environment is a safe environment for the people who have the illnesses, especially maybe depression and all those other mental health illnesses. So I think those ones would really help us. Another way is to maybe train our healthcare workers, not really deep into the mental health illnesses, because I know they are specialists for that, but would train them to be able to pick them in a patient maybe who has come in with another condition. For example, a pregnant woman can have uh, a pregnant woman who has just, okay, not really a pregnant woman, but let's say someone who has delivered, they can have postpartum depression. So she'll be able to pick it and then refer it to the right people. So awareness in that case, training health professionals, educating the communities, incorporating it in curriculum, and then social media. I think that will.
A woman who has just delivered a baby, that they also have some kind of mental illness. Can you please elaborate that?
Yeah, I don't know how to explain this one, but I think you have heard of a woman wanting to kill their baby.
No, I've never heard.
Okay, you will hear or maybe experience. Okay. So if you have not heard, maybe you experience it, but I hope you don't.
I hope
I
so
really
too.
hope you don't. And for you to not experience it, it means you have to be normal now. So we're talking of a woman who is pregnant and then they've given birth. They may experience postpartum depression. So mostly this has to do with the depression that comes after they have given birth. Now, if the woman during pregnancy had some stressors or before the pregnancy had some stressors, for example, maybe it's an unwanted pregnancy, maybe it's from rape, an act of abuse, or maybe they are not wanted by their partner or the parents. So these may affect them mentally, and then they may experience this after giving birth. And these women are mostly a risk to the baby, to themselves, and then the people that are around them. So if a healthcare worker, or maybe let's say those who were helping her in delivery, picked this up early in postnatal, they may be able to refer her to psychiatry where they get the right help. So the awareness to the healthcare workers who are working in labor ward is very important in this case.
Someone recognize signs of mental health struggles in themselves and others.
So I think all of us need to know the signs, some of the basic signs and symptoms of these mental illnesses. For example, we'll give an example of two or three. Let's say schizophrenia. You observe some disorganized behavior of the person. Maybe they'll be doing things that not no one is doing. A normal person does, I should say. And they will be telling you that they are able to hear voices that all of you are not able to hear them. They are able to see things that none of you is seeing them. So those are some of the signs of that particular disease. And they may be having some abnormal speech as well, or believing in things that normally no one takes them to be normal. As As for example, the way I said, they may believe they have some superpower. They may have a delusion of persecution where they believe someone is after them. So maybe they may try to escape or try to prepare for that particular danger. When it comes to diseases like depression, here is where you have mood symptoms and signs where someone will be asocial, where they're not being social, they are not with people as they used to be. They may lose interest in things that they used to like. They may have persistent low mood for a period of time, for example, at least 2 weeks. They may find themselves eating more than they used to be, or eating less than they used to, sleeping more or sleeping less. So these are some of the signs that you can note in a person who is having some mental illnesses. Some may say uh, some of the bad things that maybe they want to do to themselves or to someone else. So you may sense that as a mental illness to these people. When it comes to diseases like PTSD, here mostly people just experience nightmares. It's like the past keeps on replaying and replaying. So they may have nightmares. They may maybe be visiting some things that remind them of the good time of the past or the people they have lost. So these people mostly are suicidal as well. They also tend to isolate themselves. They separate themselves from the rest of the community. So these are the things that some can pick from uh, either themselves or from the people that are around them.
Okay, what do you wish more people understood about mental health?
I think the most important aspect is that mental health is part of the entire person's health. Like it's part of it. Because someone to be healthy has to be healthy mentally, socially, spiritually, and physically, according to the definition of health. So if people were to understand mental health as part of somebody's life, it would be very helpful. And it would also be important that mental health illnesses are those illnesses that everyone else can experience. They are not okay. Of course, there are those other people who are more likely to have them, but then it's normal. Okay, I'm not saying the disease itself is normal, but it's something that can happen to anyone. So if we understand it that way, I think we are going to fight stigma as well, and we'll be able to help each other when someone has these mental health illnesses. So I think these are the things that I would wish people listening to us to understand about mental health.
And that brings us to the end of today's episode on mental health. Remember, mental health is something we should all prioritize, and there is no shame in seeking help when you need it. Until our next episode, stay blessed.